69 million people around the world have been forcibly displaced from their homes due to conflict, violence, and persecution. Displaced populations are left with limited access to healthcare and forced to navigate a disjointed medical system without any record of current conditions or prior treatments.
I think that as, unfortunately, humanitarian crises around the world become more protracted, refugee clinics are increasingly going to need to manage chronic health diseases, non-communicable diseases like hypertension and diabetes that claim the lives of so many people and require complex care management. As a provider, transitioning health data from a pen and paper system to an electronic format is not just about efficiency, but at its core is about patient safety. Hikma Health provides an electronic health record that is personalizable, customizable around the needs of clinics and their particular patient population in a way that no matter where that patient goes, they will have their story carried forward in a meaningful way.
This is Hisham, a 7-year-old Syrian refugee living in Jordan with his family. He nearly died from a diabetic crisis. His parents took him to the doctor multiple times, but the doctors didn't have the medical records they needed to piece together his diagnosis. They didn't know his story. Hisham is not alone. He's one of 70 million refugees worldwide, many of whom are receiving health care that is fragmented. My name is Hassaan, and I'm the co-founder of Hikma Health. Here's a recent photo of me and my co-founder, Sinan, and our grandpa, who 50 years ago built the public water system in Damascus. In 2017, during the Syrian civil war, the system was destroyed, leaving thousands, including our grandmother, without running water and contributing to the displacement of millions of refugees just like Hisham. Inspired by my grandpa's legacy and seeking to make a positive impact, we co-founded Hikma Health. We're a tech nonprofit creating integrated health data systems for refugee patients and their physicians around the world. The name Hikma comes from the Arabic word hikmah, meaning healing wisdom. This is a waiting room of a clinic in Jordan. It's packed every single day. It was here that we realized that physicians lack access to historical data and lack access to the historical data they need, and even worse, have only 3 minutes per patient. With limited time and resources, the need for accurate health data collection is acute. This is another clinic in Lebanon where Hikma is working today. As you can see, clinicians have access to computers, but existing digital medical record systems don't work offline and don't work in Arabic. And so physicians are relegated to using paper, which is incredibly hard to read, and even worse, can be insecure. In fact, paper medical records have been stolen in the past and used to target refugee patients. So we've created Hikma, a desktop and mobile platform that allows physicians to clearly and securely record patient data online or offline in multiple languages. The data is encrypted and the system is fully HIPAA compliant. The problem here is huge. Of the 70 million refugees worldwide, 50% have a chronic illness and would benefit from better health data collection. We're really excited to be launching our pilot with a clinic in Lebanon serving 100,000 refugees this November. We're excited to expand our partnerships to reach 1 million patients by the end of 2020. Our team is led by engineers and physicians out of Harvard and MIT. Additionally, we've been able to recruit an incredible team of over 30 volunteer global health professionals, designers, engineers, physicians, all drawn to Hikma by our shared mission. We've been thrilled to reach this point through the support of a number of programs and incredible competitions. With your support, we are excited to expand our efforts to reach 1 million patients and empower them and their physicians with the tools they need to improve their health. So please join us in building a world in which every refugee, just like Hisham, enjoys access to smart, personalized healthcare. Thank you.